Welcome to the Cardinal Minute with your host and chair of the University of Louisville Department of Medicine, Dr. Kim Williams.
And welcome to a Cardinal Minute. I'm Dr. Kim Allen Williams, chair of the Department of Medicine at University of Louisville, and it is our pleasure this morning to share a minute with our medical grand round speaker, Dr. Jody Tversky, who's an assistant professor of medicine and the clinical director of the Allergy clinical practice at Johns Hopkins University. He spoke this morning on chronic rhinosinusitis, urbanization, and SARS-CoV-2. And Dr. Tversky, can you summarize your grand rounds in 60 seconds?
Yes, thank you, Dr. Williams. Thank you for the invitation. I think today's discussion really focuses on three key elements. The first is to remind our audience that chronic sinus disease is a very significant burden in the United States and worldwide, both economically and in social impacts. Fortunately, we have modern tools in our toolbox to help alleviate some of this suffering in the form of biologics. Lastly, it's important to note that there are some newer agents and newer treatment options available just on the horizon. And what's special about these is that many of the allergic and atopic disorders that we see, and that would include some of the sinus disease, may be amenable to treatment by thinking about some of the old-fashioned traditional approaches, healthy living, reducing the consequences of urbanization, and exposure to healthy diets and a healthy and natural exposure to bacteria and parasites. And so we're now using this information to design modern DNA vaccines that are in development to help treat both allergic and chronic sinus disease. So lots of exciting things to think about in the coming decade or so.
Well, thank you very much, Dr. Tversky. We're really changing our way of thinking about things, and we really appreciate your time and your expertise. Thank you.
Thank you.